Good morning, class. Here we are on the start of Module 8. Hope you all are enjoying the material so far. I think that your discussions are going very well. I have not yet looked at the quizzes or writing assignment 2 yet. Hope to get at least started on them. I will wait to publish them live on your in your grade book until I have them all completed. Okay, so I wanted to let you know that as of yesterday, around just a little bit before noon, all your midterm grades were posted. Some of you are doing very, very well. Some of you need to just make sure that you're completing the work. That's where most of you are missing points, is just not completing the work appropriately. Okay, so if you have any questions about that, please feel free to email me. This week's discussions on Chapter 5. Flexibility and low back health. Low back health is something that's vitally important to any of us. Over 85% of Americans at some point have an issue with their lower back, and a good majority of those people miss work. Okay, so it's something important to remember. When we're lifting, we need to use our big muscles, so our legs and our arms, not so much of our back, which have much smaller muscles when we're looking at the strength factor in terms of our backs to our legs and arms and stuff like that. So we need to make sure that we're using appropriate form, squatting down, keeping our back nice and straight, not twisting or turning at all when we're lifting. Those of you, a fair amount of you are going into the nursing profession. I'm sure that when you guys are out on clinicals and you're moving patients and stuff, they stress using proper body mechanics as well. All right, so just a couple things I wanted to go over. We could spend a obsessive amount of time on this chapter. This is something that when I'm going over with my personal training students, that this is a 2 to 3 week thing. I'm going to try to give you a snapshot of it here in about maybe 15 minutes. All right, so pretty much the long and short of it is flexibility is the ability of a joint to move through a range of motion. All the joints in our body have an acceptable range of motion. For instance, our knee bends from 0, which is perfectly straight, to when our heels are above, to about 135, 140 degrees. All right, so that's kind of normal for our knee, just to kind of give you an idea. Now, obviously, that's changed if we have someone who is of a larger muscular status. Maybe there's an injury to the knee. Maybe there's something like that doesn't allow us to that would prevent the flexibility in the knee to actually happen. Okay, so that's something that's important also to remember, that we have there are things that could decrease our flexibility. In turn, there's also things that can increase our flexibility, okay? And increase flexibility for our athletes and for people that are working out, it helps to reduce the chance of injury, okay? So I'm not going to go over all the big words with you right now. If one of your majors covers those, you'll get them in depth enough that you won't need my little 15-minute talk here to go over those with you. The biggest thing that I want you to do is, if you notice, this week's discussion is applying the FIT principle to a flexibility plan. Okay, so that's kind of what I wanted to go over just real quick. Some of the different types of stretching and flexibility. Some you may have heard of before, some you may not have. All right, so the first thing we're on, types of stretching, is on page 144 in your book. We're going to go static stretching first. Static stretching is probably what you're most used to seeing, to knowing, and stuff like that. That's simply when, if we use our hamstrings as an example, we're standing up, we bend over and touch our toes, and we stand there and hold it for 30 seconds, 15 to 30 seconds. Okay, that's when we're doing static stretching. That's mostly what we're being associated with when you hear of static stretching. The second type of stretching is ballistic stretching. Ballistic stretching, that is something that is no longer used anymore. What it is it's a type of stretching where you stretch to the end of a muscle range and then you sit there and bounce very hard to try to get those muscles to stretch, elongate. Theory, it's not even good in theory. and let alone not good in practice. Because what ends up happening is there's muscle fibers that aren't warmed up yet properly, tear, and that leads to injuries. For some of you guys that are still in high school or that might have played high school sports recently, the next one, dynamic stretching, is something that you're a little bit more familiar with. That's a stretching that includes a lot of movement, a lot of motion that goes along with that. Okay, so like walking hamstring stretches, where you kind of kick your legs out in front of you, or butt kicks where you're running and you try to kick your butt. It has to do with a lot of movement. The book definition of a technique in which muscles are stretched by moving joints slowly and fluidly through their range of motion in a controlled manner, also called functional stretching. Okay. When I was with professional baseball, we did a lot of this with professional baseball. It's kind of the norm now. Studies have shown, that a warmed up muscle stretches better. So, a lot of sports teams, or a lot of teams in general right now, they do a small jog, just something nice and easy, just to kind of get the blood flowing a little bit, and then they'll go through their stretching. One thing I do want to point out about stretching is not something that needs to be rushed. Okay, stretching is something you need to take your time to do because it does prevent injury. Now, injuries happen all the time. Some of them just aren't preventable. If any of you watched the NBA game last night and saw the Gordon Hayward from the Boston Celtics go down with his dislocated ankle, all the stretching in the world is not going to prevent that from happening. So injuries do happen, but the injuries we're talking about are, muscle pulls. It does help to kind of prevent those and stuff like that. Passive stretching and active stretching. Passive stretching is when you kind of relax. Any of you that have had, if you've ever had a surgery on a major joint and gone to physical therapy, sometimes your physical therapist or physical therapy assistant will do passive stretching. That's kind of where you're relaxing and the therapist kind of takes you through that range of motion. Active stretching is when you're actively stretching it on your own. You get a Charlie horse in your calf and you pull you try to kind of flex your toes up real quick. That's an active stretching type of thing. As far as back goes, there is a component of our discussion this week that deals with back. In your current job or your future job, how can having low back pain or a lower back injury prevent you from doing your job effectively? I think we all have that. We've all had that weekend where we've worked really hard in the yard or something like that, or done a lot of moving or exercise or something, and we've woken up Sunday morning or maybe Monday morning like, oh my gosh, I did way too much, and our back is stiff. Imagine people like that live in that type of discomfort every day. I'm sure we all know someone that has had to have has had an injury, had to miss time from work, or has had a back surgery, and really it's quite prevalent, unfortunately. With 80 to 85% of Americans every year suffering from lower back injuries, and missing some work. It's tough. Okay. Pay attention, please. On page 146 of your text, there is a chart, figure 5.3, that describes the spinal column. You may be seeing questions like that, similar to that on your quiz. So please make sure that you are taking, which will be after module 9. So please make sure that you are looking at those as well. Okay, so the areas of the spine, the cervical spine is right up by your neck. That's kind of your neck, attaches the neck, the cervical spine comes up and attaches to the base of your skull. Then you have your thoracic. There's 12 thoracic vertebrae that kind of helps form your rib cage. Okay, that's the spinal portion of your rib cage. Then you have your lumbar, which is your lower back. You have 5 of those. Then you have your sacrum, which is a bone kind of between your pelvic your pelvic bones. Then you have your coccyx, which is just a little tail at the end. The sacrum can show as 5 separate bones, and the coccyx can show as 4 separate bones as well. The stretches that are in the book, page 147 through 150, are very good as well. To look over and kind of become familiar with, especially if you're new to exercise, and you're questioning a little bit about what you're supposed to do in terms of being able to get ready for a workout and stuff like that. So that's something that's important also. All right. Preventing lower back pain. Excuse me. Page 152. Number one is maintain a healthy weight. In the next couple of weeks, we're going to go over weight management. We'll discuss a little bit about nutrition and things like that as in terms of not only the whole class, but it's really something that helps us, determine and help prevent lower back pain, which is important. Stop smoking, reduce stress, avoid sitting or standing for long periods of time. Obviously, we understand that you're sitting at a desk all day. The nice thing is insurance companies right now are giving incentives to employers, now not all but some, to get more ergonomically correct desk wear for their staff, people that sit at desk all day. So maybe a plyo ball chair, maybe one of those desks that you can take and go from sitting to standing and it pops up. So those are some things that insurance companies realize and say, hey, you know what, lower back injuries cost us a lot of money every year. What can we do to prevent them? Okay, well, maybe if we give companies $30,000 or $40,000 to help become more ergonomically sound, maybe we can prevent $400,000 worth of lower back bills. So that's kind of what the whole thing is as far as getting those injuries taken care of. All right. Honestly, with the lower back stuff, you're going to be able to see some of the lower back exercises starting on page 156 in your book. If you're already suffering from them, please, anytime you start something new, take it cautiously to start until you become comfortable, especially if you're adding a new exercise in. If you do have lower back pain before you start some type of, it might be a good idea to be seeked out by, be evaluated by a physician and just kind of, take care of that first. Make sure you're doing the right things. Yes, all these exercises are for your back, but based on the type of injury you have, if you have for instance, if you have a herniated disc and you do something that puts your spine in extension, so you kind of do like a Cobra type, Superman type of thing, if you do it too quickly, you might pinch that intervertebral disc there and make matters worse. So please, if you're having lower back issues already, and you have not been evaluated by a physician, before you start any of these exercises, please make sure that you do that. Really looking forward to some of the discussions this week and discussions as we get into body composition next week. And, I'm really happy with the work you guys are doing and looking forward to what we're going to be seeing here in the next couple of weeks. All right. Take care, guys. Talk to you soon.